So now I'm going to talk about the areas of focus that we have for the September rally. And there are four of them that I want to talk about. The first is symptom management. The second is interface. The third is transitions. And the fourth is prevention, public health, and policy. Now let me go back to what each of these four mean. Symptom management is an area that has been recognized around the country as having UCSF being the center of excellence across the country and internationally. This is an area that we want to continue to capitalize on. And we have to say, not just where have we been, not to congratulate ourselves on how much we've accomplished, but to say where is it that we want to go with our research, with our education, with our service, and so that is an important area. The second area is interface, and by this I mean technology, human technology interface, and that may be between the patient and the new technology, and how nurses interface in that relationship. It may also be nurse to nurse, or nurse to other health profession. So for example, their electronic medical records, how is that going to change the doctor-nurse communication pattern? There are other things that we want to look at in interface, and that includes such things as mobile health and developing apps for education and for people to manage their own health. How is it that we best design that, and how is it that we interface with people who experience that kind of technology? So that's an area that I think is very important for us to develop. I'm very excited about it because we can really be in the lead. If we look at our proximity to Silicon Valley, this is a natural for what we should be developing. The third area is transitions, and transitions is something that has come out as very important in health reform and accountable care organizations. And that is, medical centers have been growing more vertical, quaternary care. We used to say tertiary care, now it's quaternary care, much more specialized. But in the new healthcare framework, we have to look at what's happening horizontally, what is going out into the community, how do we prevent readmissions to the hospital. So this is an area that I think has shown some progress in the literature, some models from other schools, but we really need to look at together what are the optimal models of care that we can have that are best for patient care, best for family caregivers, and best in terms of reducing expenses that go along with health care. So we want to reduce readmissions, and we want to reduce the complications that keep people in intensive care as opposed to step down. So that's one area of transitions. There's also transitions in terms of people that leave correctional facilities and reintegrate into the community. There have been failure after failure in this area. How is it that we can design care to be better? And that involves research, education, and service. We can look at the fourth area. And the fourth area is prevention, public health, and policy. Our school is well known for the work that it's done in the policy arena around smoking, the dangers of smoking, and how it is that a society should be responding to that. What are some of the other areas that we should be working in? That involves the role of nurses not only in clinical settings in the community, but also their involvement in the policy arena. What are some of the future directions? What role should we be taking? So there are the four areas that I think we want to take into consideration: symptom management, interface, transitions, and prevention, public health policy.